busting out the closet.
CHHMP is a student-run clinic that is really a partnership between Columbia University Medical Center and St. Mary's Church.
It kind of started out as originally just to serve the homeless population in West Harlem and kind of this greater area of New York. But we also see people who may not be documented, they may not have insurance, or they may have insurance but be unable to pay the co-pays.
We see people who, for whatever reason, financial or other, feel like they don't belong. It doesn't matter to us.
My goal was to have students, when they graduate from medical school, based on their experience at CHHMP, they could comfortably interact with any patient they run into without having that difficulty in relating to the patient.
It's definitely an intimidating experience at first to come in your first year of medical school and meet patients who do have real needs.
The manager who does the intake then assigns a preclinical and clinical student as a team.
They conduct the interview, they do the physical exam, and then they will present the situation or the case to their medical attending.
Hey, Mr. Nazario.
Yeah.
Mr. Nazario is actually a great example of someone who is very concerned and willing to work towards improving their own health. So we'll have you sit here, if that's all right.
I wanted to tell you something.
Yeah, what's up? He always comes to clinic with questions, very intelligent questions about his health and about how he can help himself. And that's the ideal situation. So how have you been doing?
I've been doing a lot of walking, believe me.
He walked 13 miles.
Wow, nice. It's the best way to bring down this blood pressure too.
Yeah, exactly.
Not only taking medicine, but just bring it down, you know?
It's difficult to say for sure, but if Mr. Nazario didn't have CHHMP as a place to get refills on medications, he may have just stopped taking them. And just as we saw a couple of years ago, it could have led to another hypertensive crisis. And that's really scary to think about.
Over here, they talk to you and they tell you the truth. They do it with love. And if it was not for them, I would have been a goner. I would have been dead already, you know?
I think it's one of the strongest things about CHHMP is that the patients will come back not because we've provided all this extensive free care, but because they feel they've been listened to.
Unlike an average doctor's office, we have potentially an hour if we want to interview patients, as opposed to 10 to 15 minutes.
So having these longer interviews really lets us to get into these issues that otherwise might not come up if we were focused purely on a specific medical need. Because sometimes it's not about having diabetes or having hypertension. Sometimes it's about the fact that you don't have somewhere to stay tonight.
Mr. Dotson, he's somebody who's very independent. His whole life tried to stay away from the healthcare system. He wants to think of himself as a strong person. And when he started doing chemo after his surgery, it was very rough. And we started getting a little bit nervous about whether he would be able to make it through his whole treatment. We were worried about his mental health. There's definitely a higher rate of suicide among single, white, older men who are dealing with a disease like cancer. So how do you go about asking somebody, are you suicidal right now? And I know his baseline, I know he loves shows, I know he loves music. So I can really gauge where he's at based on how he's talking about the music, how he's talking about the opera. And I think establishing that rapport, that has its place in healthcare. We're not here just to talk about the symptoms. We're here to talk about you as a human being and what you care about. And that says a lot about your health, it turns out.
One of the wonderful things about CHHMP is the multidisciplinary team. We have a team of dental students and dental attendings here.
Does that hurt right there?
No. And we also have a wonderful diabetes educator.
And now occupational therapy is also a big part of this, and the healthy lifestyles aspect of medicine, which is such an integral part of what primary care is.
A lot of our patients, they also need a little bit more in terms of psychiatry resources or consultations.
We have a denture program here, so we can make dentures for you.
Okay.
All right.
Thank you.
Yep, no problem. So you're good to go.
It's a group that really comes together, the medical students, the resident, the attending.
I've gained so much insight into the incredible things you can do for patients with minimal resources.
I do think that it has affected how I live every day.
It's really an incredible sense of having an effect. I think it's very special.